Good morning, everyone, and welcome to the Health Careers Live Middle East Global Roundtables. I am Faisal Nawaz, an ambassador at Health Careers Live and a recent medical graduate from Dubai. We are pleased to begin this global roundtable discussion on In the Know, reflecting on global health system strengthening and international recruitment for medicine and nursing. As your host for the session, I'm honored to introduce our panelists who bring extensive knowledge, experience, and perspectives from their respective fields. Tista Chakravarty-Gannon is the head of outreach operations at the General Medical Council in the UK. Tista has worked in the service for over 20 years supporting survivors of abuse. She also co-leads the outreach team at the GMC and heads up or welcome to UK practice work to support doctors who qualified overseas. Besides leadership responsibilities, Tista's GMC role involves engaging with doctors, system partners, and developing workshops on ethical standards. Prior to joining the GMC, Tista spent many years in stakeholder management and worked full-time with survivors of abuse, particularly in children's and mental health support services. More recently, she has worked on collaborative projects with the Gold Standards Framework, Marie Curie, and RCGP. Tista still provides support to survivors of abuse and is involved in collaborative projects to empower women and children. Tista is passionate about the NHS and has particular interests in safeguarding medical leadership and quality improvement. It's nice to have Tista with us today. Our next panelist is Reem Al Jayyousi. Reem is a practicing nephrologist at Mediclinic City Hospital in Dubai. Reem completed undergraduate and postgraduate training in medicine and nephrology in the UK. She holds a PhD from the University of Leicester and was involved in clinical research trials in the field of nephrology and vasculitis. She is also active in medical education for the last 15 years in undergraduate and postgraduate training and brings a rich background from the Middle East and UK health systems perspective. Thank you for being with us today, Reem. We also have Tracy Collins. Tracey is the International Nursing Workforce Lead for the NHS Alliance for International Recruitment. An inspirational senior nurse with a passion for global nursing, Tracey has had the privilege to have worked in many senior nursing and general management roles within the NHS, along with specializing in intensive care nursing. Tracey's special interest is in the nursing workforce and the global nursing agenda after having worked with many partners and healthcare institutes overseas. Tracey has influenced career opportunities for many nurses and healthcare professionals from around the world into the NHS. The aim being to influence healthcare through knowledge exchange, shared learning, leadership development, and competencies for the benefit of all our patients. Tracey's ambition is to continue to raise the profile of global nursing, both personally and professionally, through continued partnership, development, and ambassadorship that will contribute to a sustainable nursing workforce in the future. Once again, a warm welcome to our panelists and audience members for joining this insightful roundtable. For our audience members, please use the virtual chat section for any questions that you may have for our panelists at any point during this session. Now that we have this global roundtable ready to be kickstarted, my first question is on the topic of global clinical training opportunities. And the question really is about why should healthcare workers around the world consider global clinical training as compared to staying in their native countries? What are some incentives and benefits for such global clinical training opportunities for them? And the question is open to our panelists.
Thanks. Sorry, Faisal. Good. I'm glad you said Tista, because I was going to ask for a repeat question, so I'll let you go ahead first.
Thank you. Yeah, I think that's a really good question, Faisal. And one of the things that I think is really important here is the opportunity to share learning globally. Only yesterday I was speaking with someone who trained overseas, came here, and was really surprised about how we manage, or sometimes don't manage, frankly, rota gaps and the significant stretch that we have with rotas, which means that any absence, whether that's holiday, whether that's sickness, can really add to that stretch and amplifies workload and pressures. And in the trust that they were working at here, they shared some ideas from where they qualified around essentially non-resident on-call rotas, reservists, and how junior doctors were rotated where they had worked previously. And their trust here used that. So it's less in that scenario, it's less about clinical learning, but it was a brilliant quality improvement initiative that really helped. So I think there are huge opportunities for learning, sharing, and I'd like to see a great deal more of that.
Thank you, Tista. I think that's a very unique perspective, because rotas and these sort of health system changes that international doctors and nurses might be facing as a transition, moving from, say, the Middle East to the UK or any other country for that matter, is something that either works in their benefit or could be a barrier for learning. So to understand that and build the needs of the workforce even further, I think is a very well needed perspective to add. I'm also interested to hear from Reem's side. So the question is really more about what are reasons for why healthcare workers should consider global clinical training. Why should they consider moving out of their native countries where they're already pretty comfortable and probably used to the health system on their own? So what should be a driving factor for them to consider?
So there are, I guess, many driving factors. Continuing personal development. So there's always a different way to do things, and seeing just one way is not. So seeing different ways, you bring in the best, hopefully, and combine them with what you have locally. So that could be, as Tista said, in administrative side. It could be in clinical protocols. So for lots of things, there are many ways to do it, and some things are more applicable locally, so you can't transfer them globally, but you can learn to look at them more critically globally. And then you also, you form alliances, people that you can talk about, particularly in my field, which is rare diseases. It's always useful to, when you only might see one person in your area that has a rare disease, that you have you connect with international, and it's not the same connecting internationally by email with someone you've never seen as somebody you might have worked with or in an area that you worked with, and you know what's there. So there's benefit to the patient if you work globally and then come back and transfer some skills and make these contacts and networking. And of course, for education, it's invaluable for education to have traveled, learn different education skills, and bring them back to where you are. And on a personal level, well, you travel, you see people, you see different perspectives, so you get patients. The world is one place, and there are international patients everywhere now. So I think connecting with your patients pool and seeing there's what we know. We know some differences like languages and some cultures, but there's a lot of what we don't know. And until you see it in a different culture, you really can't imagine that it does happen in a different culture. And it's really quite mind-opening to see people practicing different cultures.
Thank you, Reem. I think that was very insightful from the point of, both personal development being an important reason for healthcare workers to consider global training opportunities. And then there's the point of learning and education and expanding your network, as you mentioned, both from a personal clinical training background and even from a patient care background. So I really appreciate that side, and I think what you've seen also is from a unique point as someone who has practiced in the UK, is currently practicing in the UAE. So to see that as a positive experience from your side is very important to appreciate. I'm also now interested to hear from Tracy, who is driving the nursing workforce perspective here. And Tracy, what could be from a nursing side of view, or even just a general healthcare side of view, reasons to consider when it comes to such global training paths and practice environments?
Thanks, Faisal. And international nursing is a huge passion of mine. And, we're very fortunate in terms of the NHS, in terms of the opportunities that are available. There are so many specialities where nursing and midwives and all healthcare professions can come to the NHS and really expand their knowledge and their skills and competencies for the better of their patients wherever they are and wherever they choose their careers in the world. I mean, for example, there's medicine, there's surgery, there's critical care, there's emergency, there's research, so whilst you can work in an acute hospital or a trust, you can work in the community setting, there are wider systems work, there's research, there's just huge opportunities. And I first started international recruitment of nurses back in 2014, and that was for my local trust. And it's wonderful to see that some of those nurses that started off in their very early careers are now ward managers or senior sisters, or they've ventured into research, which is incredible to see their careers grow. But personally, myself, my career background starting, I've always been so passionate about nursing from when I was a young child. It's a profession that I've never deviated from, and I qualified as a nurse many years ago, and I won't say when because that just gives away my age. But anyway, a long time ago. And I then, chose to specialise in intensive care, which again sort of gave me that, really wonderful sort of critical care experience. And then as my career grew and I stepped into nursing workforce and into senior nursing leadership positions, general management positions, I then had the opportunity to work with international nursing. And it was at that time that I realised, I had a real passion for that, and actually I was able to sort of influence and share some of my nursing experiences with nurses and healthcare professionals overseas, just to showcase and share really that here I am, I'm a registered nurse myself. These are some and of the opportunities that are available. And having worked with many nurses from overseas, to have dual or triple registration is incredible. Whether nurses are here from the Philippines, from India, from the UAE, wherever in the world, they're qualified nurses that come through into the NHS and they gain a registration and a PIN number here to qualify as a registered nurse here in the UK. And whether they choose to stay, or whether they move to the States, or whether they move back home, that enriching of that skills and experience and competence to take back to either their home countries. Our early career nurses, are our future leaders of tomorrow. So really enriching that personal and professional growth is only for the benefit of our patients and staff and families. So I hope that's helpful.
Thanks, Tracy. I think that was pretty much on point from the point looking at how nurses are playing such an integral role, be it from the point of different specialities in healthcare. And then there's the areas of growth and the opportunities that brings. I mean, from research to career progression. That's one common theme that we're looking at the moment, which is how such global training opportunities could give room for career progression, for diversifying into different areas, and then perhaps even the option of going back to sort of the countries where they've come from and investing back those skill sets that they've gained in the NHS in the UK. So it's great to see how that it's not just limited to the main country of work, but rather a long-term plan to even have their own countries benefiting from it. So thank you for sharing that, Tracy. And I think we've covered sort of the benefits and the reasons for people to consider going, from the Middle East to the NHS or any other country for that matter in terms of such global training opportunities. My next question is sort of a contrast on this note, which is about the barriers that some new healthcare professionals could face when joining into the NHS workforce. What are some potential barriers that either you've seen from your working experiences that could be sort of from a either Middle East to the UK point of view or any other country for that matter? We could start from Tista and then sort of have the discussion forward.
Thanks, Faisal. Again, I think this is a really important question, and it's something that I am very close to. One of the reasons you mentioned that I head up Welcome to UK Practice at GMC, and one of the reasons we created the Welcome to UK Practice course was because of the barriers, the challenges that colleagues experience. And we've already talked about how it's an enriching experience, so we wanted to make that journey into UK practice easier. And over the years, one of the things I've learned, in some ways it's intuitive, but I think it needs to be said that one of the primary barriers is that it is hard. It is hard to move from the country that you are familiar with, where you've got your support networks, your family, friends, a certain way of being, and to move from all of that to a place with an entirely different culture, potentially, different expectations, different systems. And at the moment, I'm only talking about day-to-day living. I'm not even talking about medicine, which when you get into that, again, all the same things apply. The NHS, despite having worked here for 20 plus years, is a terribly complex beast to explain, especially as we reorganize every couple of years. So, just getting used to the system of living as well as working. So without laboring it too much, but I kind of put it in terms of Maslow's hierarchy of needs. So the very, very basics around accommodation, around bank accounts, driving, school. So those things that give you psychological safety. If you don't have support with that, and it can be really, really challenging. And there are several anecdotes of people saying, people tell me it was cold. I didn't realize it'd be this cold. I mean, today it's boiling, but usually, yes, it is that cold. So these are some of the barriers, helping people acclimatize and giving them that proper support, ensuring that there are networks, and that may be, diaspora networks, as well as networks within medicine, and then explaining the medico-legal system, medical ethics, patient expectations. So these are all barriers, but you can see that there are enablers. There are a way to help around those issues as well. But in terms of the question, I think those are the things that we hear most about.
Thank you, Tista. I think you've touched on such a valuable perspective here, because it brings in the personal experiences of, I'm sure, many who are either in the UK at the moment or beginning the transition, say, from the Middle East to the NHS, and to have those sort of personal barriers come in, and often the ones that are overlooked, be it from, like you mentioned, financing or accommodation, and then the culture change that comes with it as well. And the weather can be quite a contrast, especially if we're looking at the Middle East and then moving to the West. It's very challenging. So these are some barriers that definitely come in. And then there's the ethical side, where I think you've mentioned about how learning about the ethics of the health system, which could be different or similar on different, perspectives. I think that's another level of barrier, and the work you're doing as part of welcoming them and creating initiatives where they're comforted in this transition is quite appreciated. I'm also very keen to now hear from Reem's perspective, where I think that comes from a very personal experience where you've already seen the transition, and you know how different it can be working in the UK and working in Dubai. So from that perspective, Reem, what are some barriers that you think healthcare workers in general could be struggling with?
Thank you. I mean, for me, the barriers were understanding the system. We are, all the systems have the good and bad, for sure. In the UK, we're very fortunate. It was lovely to be a doctor where you don't even know where an insurance office or a cashier office is. You focus on the patient care and the job ahead of you. Yes, it doesn't mean you can always get what you want, but there is a kind of a standard way of requesting things. When you move to an insurance-based system, you need to be aware of that and how you can manage that to the best of your ability for your patient. So there might be additional documentation, understanding that you might have to really focus on sometimes what investigations you really want, because you might not be able to get all the investigation that you ideally would like to have. So really getting a knowledge of the system, and I'm sure courses like one Tista talks about approaches these, understanding the admin supports, understanding the follow-up system. So that can be difficult. So for me, that would be the major thing, is how you move from that entire healthcare system to another. But also touching on Tracy's point about nursing, and also I wouldn't want to say take it for granted, but in the UK we have a lot of nursing support from our the very nurse specialists who work hand in hand with us, all the nursing team, and that's not a system developed everywhere else, particularly an insurance-based system, because the charging for nursing might be different to charging for doctors. And I certainly appreciated a great deal, still do, and I didn't take it for granted, but that's one of the things I found more challenging, working in a system where the specialist nursing working with you, that partnership is not as available. So you have to rely more on yourself, and that's not all. You sometimes feel like you really have to check and double check, and it's nice to have that different perspective in caring for patients. So it's understanding what the systems are, what the multi-professional team looks like, who does what in your multi-professional team, and multi-professional work is very well developed in the UK, and is very well developed across some areas of the Middle East, but it's not as standard, and you have to know that, because it's a limitation to practice, and we work best when we're working with a group of people who see things from a different perspective.
Thank you, Reem. I think you've looked at how admin related challenges could be one of the major barriers in that case, and I think taking your perspective as someone who's worked in the UK and is currently in the Middle East, it really helps us see how things like insurance, which one would probably never consider, or in rare circumstances in the UK, it would not be a common thing. And in that regard, it becomes a huge learning curve for doctors who are looking, or nurses who are looking to adjust with the system in the UK, moving from an insurance-based system. And in that regard, you also touched on multidisciplinary work, where how certain systems could be in favor and sort of work naturally in that regard. And maybe there's some work that could be done from the Middle East side of things, and that could add to an advantage for someone who's looking to move into the UK in terms of workflow. So these are some very, I think, valuable points you've touched on. And I think the mic is now open to Tracy's side, where from the nursing background, what are some barriers, especially because of the very diverse workflow of nurses, and not just from a specialty point, but from a cultural point as well. What are some barriers that you've seen throughout your career in this regard?
Thanks, Faisal. And I echo what Reem and Tista have already said. And I have to say, I'm in awe of all of our international staff, that come to help in the NHS and work in the NHS, to leave their loved ones and babies and, young families, behind for months and sometimes years, to make a real difference for them, back home. I'm in awe of what they do. But we are incredibly lucky within the NHS to have a very multicultural healthcare system. We've got healthcare professionals from all around the globe working, in all specialities. But the one thing from my experience is, and particularly at the moment coming through the pandemic, we're all recovering from that, is the time, particularly here on the ground in the clinical areas, to support, our staff from overseas. Everybody wants them to have a fantastic experience, to be able to help them to settle and to nurture them and to help transition, into their careers and times here. But it's tough, when staff, first arrive, the clinical areas are very, very busy. Everybody's in recovery plans. And of course, sometimes, there isn't always that time just to stop and think, in terms of where people have come from, and actually the importance that people do need extra time to adapt and to settle. But within the NHS, from a pastoral perspective, I have to say this is really high profile at the moment. And I think I'd like to hand on heart, particularly in Devon, we do it well from our pastoral support element. We have a real pastoral framework that's in place. There are many trusts and collaborations across the NHS now in the UK that are really focusing on the importance of, looking after and wrapping your arms around our staff from overseas coming to help and coming to work with us. So there are lots of initiatives, including a national kite mark for pastoral care. So it's like that quality award sort of stamp, which hospitals are working towards. There's a set of standards which they have to meet in order to demonstrate the pastoral and care support for staff from overseas. So within Devon specifically, we have our YouTube channel, which is focused and pointed towards pastoral support, and it talks about accommodation, it talks about cost of living, it talks about career opportunities, how to come through into the NHS, but also of what it's like, when you're here speaking with colleagues and nurses and healthcare professionals around, what's their experience. And I know one of our nurses is in one of the events later on today. And I think, again, as Tista had mentioned, one of the big things was the temperature, the climate difference, and how cold it was here coming from the Middle East. So, and we don't always think about that, do we? But we have, when nurses arrive, we bring them to the hospitals. This is part of the NHS pastoral mantra, that the staff come to the accommodation. They're given induction. They are given welcome meetings. They have a period of time of supervision where they're working closely with mentors or a buddy. That's really important in terms of learning, the new system, new policies, how things are done, even different nuances in terms of accents here in the UK. And I know there are lots of people that say to me, Tracy, please speak slowly. And it's important. We in the UK we tend to talk quite quickly, but there are different expressions, and that's really important to take time to support our staff from overseas in terms of, we might say, for example, see the wood for the trees. but what does that mean for a person from overseas? So, you know, it's different to how we interpret it. So it's all of those nuances, you know, that we have to be mindful of. And for all our new qualified nurses here in the UK and our new international nurses coming through, there's a Preceptorship Program as well, which is, again, how you transition from either a newly qualified nurse or a new nurse coming into the NHS, giving them that support and that safe space in terms of being able to speak open and freely about any concerns, any worries, and how they can actually be supported in terms of transitioning. Because ultimately, we want people to be happy here. We want people to stay, further their careers, and then choose where they want to be later in life. So it's important that we make sure that pastoral support is really there. And I have to say, I do think within the NHS, we do that fairly well.
Thank you, Tracy. And we want people happy here. I think that's something that's really stuck to me. And if we keep that as the vision, then perhaps, you know, this could be a standardized approach across the UK, where welcoming new healthcare workers would be sort of a transition that's for the benefit and in a way that is integrated into the system. You've touched on the idea of time, and I think that's probably one of the biggest challenges healthcare workers could face, which is just the delays and the other both social and financial barriers that come in along the way during this transition. So thank you for sharing those points. And also the initiatives and programs, I think it's very unique to see that there's so much work going on to help people, you know, eventually transition from countries around the world, including the Middle East, into the UK, both in the form of mentorship, preceptorship, as well as resources available to navigate this change. I think one thing that probably still would be a challenge would be the weather and the climate change, but that's probably outside our control. But I think it's good to see that as a heads up, and I think that's another point where having awareness of how different that culture and climate could be also plays a very important role. And that is sort of bringing us at a point where our audience members are also more than welcome to ask in any questions during the session. There must be a live chat section that you can use, and our panelists are more than happy to have your questions on board. So feel free to use the comment section. We'll now move to sort of the I think the bigger question here, which is from the point of really improvement and recommendations for the health systems. And the question is really, how can leadership organizations in the UK improve the current working environment to prepare and welcome the future healthcare workforce? This comes from the perspective of both leadership organizations in the UK and perhaps even international organizations that might be playing an integral role in allowing this transition to happen. So this is our theme for the current question, and I'm open to Tista's perspective first and then moving through the panel.
Great, thank you, Faisal. First of all, I just want to say it's absolutely fabulous to hear what Tracy was talking about there in terms of the pastoral support being provided. And I'm going to take a look at that YouTube channel later, because that sounds brilliant, really, really brilliant. So I have to be honest, what I'm hearing from Tracy, and I've heard from other colleagues about nursing support, and it's brilliant. It is absolutely amazing. Although it is also fundamentally the minimum that we should be doing. Being honest, this is not what we've seen in medicine. There has been real variation. So I know of organisations that do exactly what Tracy has described. One of the trusts that I work very closely with, they do things like provide driving lessons, language cafes, all kinds of wonderful initiatives that really, really support their IMGs, their international medical graduates. And then I have heard of organisations that say, here, do your stat man. That's what statutory mandatory training, e-learning. Do that for a few days. There you go. You're safe now. Go out onto the wards. And that's it. So that dichotomy of experience very much still exists, I have to say, when it comes to medicine and supporting international medical graduate doctors in the NHS. But I have to say this event today is incredibly timely, because I am delighted that something a number of organisations have been banging on about for a long time is on the horizon, and that is a standardised supportive induction for international medical graduate doctors. And in fact, I'll speak about it later. I've got a slot later, but in fact, on Monday there is a huge webinar in fact, Healthcare Careers Live colleagues are supporting, where we'll be launching this induction, welcoming and valuing IMGs. And it's a huge collaborative project that we've been working on for a number of years now, slowed down, of course, by the pandemic, but amongst NHS, Medical Workforce Race Equality Standard, Health Education England, the British Medical Association, GMC, we have co-produced what is this a comprehensive welcome, and that includes all that we've talked about today. You know, the local orientation, the support, the language elements. I'll always remember a friend of mine saying when he started practice here, he used to get so confused with Sister calling him Duck. It's like, all right, Duck. Like, what do you mean? So yeah, the dialects, the language, all of that kind of thing. But then also, as Reem talked about, the systems, the differences there. So it's an in-depth, comprehensive induction that also goes specialty specific. So the Royal College of Psychiatrists, anaesthetists, they've all written sections for me as well for it. And it also provides for ongoing mentorship and support as well. And from our point of view at the GMC, if you are an employer recruiting international colleagues to support patients, then it is incumbent on you to provide that pastoral support. It is the right thing to do morally. And of course, that also promotes patient safety. It is not safe. It is incredibly unkind, but it is also not safe to send a colleague on towards 2 weeks in, having only done e-learning. So we must have this standardized induction rolled out everywhere. And finally, just to comment on that as well, something I'm really passionate about. To be clear, we mustn't see this as a deficit model. Because when we were talking earlier, I was talking about learning that we can adopt in the UK as well from colleagues coming from overseas. And sometimes we talk a lot about how we need to support our international colleagues. And of course we must, for all the reasons that we've rehearsed today. But we also need to keep our eyes and minds open to the learning that we can adopt. So this induction, it is not a deficit model. It is the logical, moral, appropriate support for anyone moving to an entire different country and system. But on top of that, it is also to improve our own literacy of what our IMGs can bring us as well. So yes, that's what I think leadership organisations should be doing. And sorry, you also mentioned international organisations. There are some really, really good models actually where we start this work from before colleagues join us. a bit like the conversation we're having today. But for example, I remember working with international organizations to develop a VR, a virtual reality learning module, and running Zoom sessions for colleagues who wanted to come into primary care here, because primary care in the UK is wildly different from many other countries. So we, whilst they were still in their country of qualification, we started training, and then we developed this VR app that lets them see. So my friend's GP practice, general practice, he let us use his surgery, and we filmed in there so people could actually see, yes, this is what a GP surgery looks like. This is what I might be encountering. And we wrote a scenario for a patient at the end of life to help colleagues understand what they might be doing in general practice and the scenarios they might be encountering. So there's a lot of work that can start before colleagues arrive as well, where international bodies can really help.
Thank you, Tista. That is just phenomenal work, I think, happening from the GMC perspective, and even the long-term initiatives that we're looking at, especially with the welcoming initiative, the induction, the standardization towards this platform, and then the engagement that these workforce needs at the moment from a medicine point and a nursing point as well. And I'm glad you brought up the gap that we're currently seeing between sort of the nursing and the medicine transition. And on that note, I'm happy to also hear from Reem's perspective on how these recommendations for change could help, if there's something that medical trainees or doctors who are joining in could keep in mind from an organization point and even from a transition point of view. Over to you, Reem.
I'll unmute, thank you. So the question relates to what organization leaderships can do to support the process. Is that about right? Yeah. I mean, different little things, not always easy to implement. So it'd be really nice if new colleagues, wherever they are in any direction, have a period of shadowing, if that's permitted. But the reality of life is they come in. The reason they're there is because there's a deficit in the workforce wherever you go, and that you're required to hit the ground running. But a period of shadowing to acclimatize to different things would help people settle down and know the ways. And all the things that Tracy and Tista mentioned about having the pastoral support, because that with it comes a lot of things. Knowing that you can go to someone when you're in trouble as well happens. A lot about understanding the complaint systems, not just through doing the e-learning, but perhaps some real life experiences about where that is, because that entering a culture where you a different place and you may do something not wrong, but administratively perhaps not the right path, getting that first call to say, oh, you've messed up, but hopefully they haven't harmed. It's really quite a knock. So understanding the things that might destabilize workforce. So some shadowing, understanding where the complaints, because with understanding that, you kind of understand some of the intrinsic issues you deal with, and just simplifying and making it easy to be aware of what these mandatory training requirements are. But everything else has been mentioned by Tracy. I'm just thinking about myself when I came, what might have helped from an organizational perspective that could have made a difference. I mean, it took me a while to understand how to submit admin issues primarily, but for me, for example, if I had sat in with somebody for a while, I understood how patients in a privatized healthcare system come after having gone to many different organizations, and the data you have to collect from so many different organizations, it would have saved me a lot of hassle after the first few months. So if they can facilitate a period of overlap and shadowing and understanding of the complaints, I think that would help from a leadership perspective.
I absolutely agree, Reem. I think this is about making sure there's a connection and engagement that's built between the workforce and such leadership organizations. And that comes from a lot of these hands-on experiences, be it shadowing, preceptorship, and then having some even technology-enhanced experiences like virtual reality-based initiatives. So these are some great ideas. And I think your perspective, again, from a very personal transition point of view, plays a role here in understanding the gaps that currently exist in the system. I'm also keen on hearing from Tracy's side on how leadership organizations who still, there is a lot of work to be done. We do acknowledge that, but in what direction should we be heading to allow this transition?
Thanks, Faisal. So there's a couple of things for me. I mean, so here in the NHS, I mean, there's a lot of the leadership organisations are really trying to support in terms of programmes, specifically for transition of international healthcare, workforce coming into the NHS. And there's the diaspora groups, which Tista mentioned earlier on as well. And we spend a lot of time sort of with the diaspora groups, in terms of drawing on their experience and help and support in helping our staff, transition and settle into the NHS. So BAPIO, for example, and there's BINA, British Indian Nurses Association, and FINA, Filipino, etc., etc. So there's a lot of support that actually is already there and happening, but it's about just drawing on that expertise sort of, internally. But there's something, I mean, yes, that we're doing a huge amount in terms of partnerships, collaborations, and actually sorry, you're still there. Sorry, I had something come on my screen then and I wasn't sure whether you're still there. Yes, there's a huge amount of collaborations and partnerships happening at the moment, but I think there's a huge amount more that can be done. Certainly in terms of the global awareness, that collaboration, really trying to embed some of that global work and in citizenship into the work that we do. I know I've had the privilege and pleasure of working in the national role with Health Education England and the Global Engagement Directorate, and they are doing some incredible partnership work out there in terms of health system strengthening, and actually trying to bring that into the NHS. And I think there is definitely something around raising that awareness. How do we embed that global learning and that global citizenship into our healthcare systems here in the NHS, into the collaborations across the country, into the ICSs in the country? One of my ambitions is to bring some of my experience from previous roles into the role that I'm doing now, where we can become a global centre of excellence and where we can start to sort of really plan and reach out in terms of partnerships, collaborations. How can we, look at offering sort of exchange opportunities? How do we create that space for staff to spend some time, a small period of time, overseas or through virtual, sort of mentorship, support, volunteering? How can we expand that awareness? Because that's incredible in terms of how, understanding the whole challenge that we've got globally, particularly the workforce challenge. And I'll just touch on the Nursing Now challenge, the State of the World's Nursing Report, State of the World's Midwifery Report. By 2030, there's a global shortage of nurses of 6 million predicted based on the trajectories at the moment. So there's a huge gap, and it's really important how we raise that profile. How do we attract more into the healthcare professions? How do we retain? How do we invest in that development and education? It's really important. So it's not just here in the NHS we have a workforce challenge, we have a global workforce health challenge. And it's really important actually we try and spread that word, really try and expand the global work that's going on, and allow a bit of that space and time to think and see how people can actually have those opportunities, to learn from each other, Because yes, of course, the NHS has got a lot to offer for people from around the globe, but actually we've got a huge amount to learn and from other people from overseas. It absolutely is. And I think when you've had the privilege of being there and meeting many people and working overseas, it really does, give you that humbling sort of, perspective. And I think that needs to be spread. And I would love to see somehow in the future, built into the nursing curriculum somewhere, that actually there's this opportunity created to work with a college or a clinic or somewhere remote overseas for that small amount of time, because it's very, very grounding in terms of what that delivers. So I hope that's helpful.
I think that's more than helpful, Tracy. Thank you for sharing that. And I think what you've touched on, which is about creating spaces for such growth, such collaborations, and then panel discussions of this sort, where we have perspectives that are so valuable coming in from the side of medicine, the GMC perspective, and then the nursing workforce. These are the conversations that I think would drive the change that we're looking for, rather than having isolated systems of work, standardization of care, both for the patients and for the future of workforce, considering the challenges we're currently facing. On this note, it's again been such a pleasure to have each of you on board with us, for sharing such diverse experiences and potential for collaborations, potentially between the Middle East and the UK health systems at some point, to understand the transition that we could see as healthcare workers. It was an honor to moderate this discussion. And I'm happy to have any concluding thoughts from our panelists, and of course, any last minute questions that might come up from our audience members. Any comments furthermore from either of you panelists?
I was just going to follow on from Tracy's point quickly about traveling out from the NHS. So I was thinking if I come back to the NHS, having worked here, I'll have a little bit of understanding of the challenges that people coming to work in the UK from the Middle East might have, having experienced the different work style. So obviously that's only a small shot. It's a small place in the whole world, but some different insights about how things work differently, and that might give us a little bit more insight into what challenges we can support colleagues with when they come to work in the NHS. So the more of people within the NHS or within any healthcare system here travel and work different elsewhere and come back, we'll all have a better understanding of the challenges we all can face and support each other when we make that transition to a different workforce. And thank you for having me.
Of course. No, this was a wonderful conclusion, I think, and a take-home message for all our audience members and viewers from different parts of the world. Again, it was a pleasure hosting and moderating this discussion. And for our audience members, this is just the starting panel, and we'd be moving into networking with the keynote panelists and with other members as well. From the Health Careers Live point of view, we're really happy to host this event and have all of you come together for this experience. And then shortly after in the day, we would be moving towards an early career trainees panel as well. So that would be an exciting aspect to join in for. Thank you again, and we hope to see you in a bit.
Thanks all, a pleasure.
Bye.